So this video looks at the ICD, which is the International Statistic Classification of Disease. So the DSM is an American diagnostic manual which has huge influence because of the clinical research that happens within America, but the world's most popular diagnostic manual is actually the ICD, which is currently in its 10th edition. The ICD is supported by the WHO, the World Health Organization, and is supposed to be updated every 10 years. However, the ICD-10 came out in 1994, and the ICD-11 has been pushed back to being published into 2018. The ICD was originally the International List of Causes of Death, and it got its current name in 1949 with the ICD-6, which also introduced mental disorders for the first time. The ICD is produced free of charge by the WHO, and its aim is to improve healthcare across the world. It includes all diseases and disorders, not just mental disorders, and the ICD-10 includes 10 groups of mental disorders, such as delusional disorders, mood disorders, clinical and personality disorders, etc., and its bases, its diagnoses around symptoms. So how does the ICD work? Well, the ICD contains different sections, and in section F, which is specific for mental health disorders, within this section, the ICD groups each disorder as being part of a family. So, for example, depression is part of the family for mood-affected disorders. These disorders are coded F, followed by a digit to represent the family, so 3 for mood disorders. This is then followed by another digit to represent the specific disorder. So F32 is depression, whereas F31 is bipolar disorder. The more digits tell you how specific the subtype of the disorder is. So, for example, F32.0 is mild depression. Finally, very specific categories can be added by further digits. So, F32.0.00 is mild depression without somatic symptoms. The clinician can use the system to guide the diagnosis through a clinical interview with the patient. So, first identify that the client has a mood disorder, then what type, then what subtype, etc. The process is not as easy as I make it sound because mental disorders are really difficult to pin down, but the classification system actually helps diagnosis, making it more likely that different clinicians will arrive at the same diagnosis, adding to the reliability of the diagnostic system and also making sure that the diagnostic is true, which is the validity of the manual. Many mental health professions defend the DSM-5 and its principles. They argue that while the DSM and the ICD may be flawed, it's better than anything else that's currently available. The DSM-5 was greeted positively in the UK by the mental health charity Mind, because they say that diagnostic manuals are also important for research. If you're researching schizophrenia, then you need to agree on what counts as schizophrenia beforehand, because it's impractical to carry out full psychological assessment of every individual taking part. The bombshell research by Rosenhan in 1973, which is your key classic study, showed how important it was to make the diagnosis more valid and reliable. Mitchell-Wilson from 1993 suggests that the DSM-3 was developed precisely to tackle the unreliability of previous systems. There is evidence that the DSM is improving. Brown et al. In 2001 tested the reliability of DSM-4. They studied anxiety and mood disorders in 326 outpatients in Boston, the USA. The patients underwent 2 independent clinical interviews, and there was a high-level agreement for most of the DSM-4 categories, and this is completely different from what Robert Spitzer found back in the 70s. Despite the concerns about over-medicalization, the DSM-5 has fewer diagnostic categories than previous research. In the past, patients who ticked all the boxes automatically qualified for a diagnosis. The reception to the new DSM-5 has been mixed. The British Psychological Society published a largely critical response in which it attacked the whole concept of the DSM. The ICD-10 is distributed freely by the World Health Organization and can be viewed online. The DSM must be paid for and generates a huge income for the American Psychological Association. The ICD-10 and the DSM-5 are very similar in many ways, describing the same disorders and often using the same wording. Unlike the DSM-4, the DSM-5 now uses a system-based approach that the ICD has always followed. There has been found to be only a 68% agreement between the ICD-10 and the DSM-4 on an assessment of 1,500 patients. This was by Andrews in 1999. However, Andrews found agreement on diagnosis for depression, substance dependence, and generalized anxiety. Hoffman et al. In 2015 compared the DSM-5 and the ICD-10 in a study of alcoholism among 7,000 prisoners. The two systems agreed in diagnosing healthy individuals and those with severe alcoholism. However, the diagnosis differed when it came to mild to moderate alcohol disorders. About a third of those with mild alcohol disorder, according to the DSM-5, received no diagnosis from the ICD-10. The studies by Andrews and Hoffman both suggest that there is inter-rater reliability and concurrent validity within the DSM and the ICD, but the reliability and the validity could have been a lot higher, especially with the mild to moderate conditions. Although the NHS uses the ICD-10, the DSM-5 has a massive influence on how mental health is thought about and treated in this country. It helps set research agendas, bring conditions into the public eye, and influences clinical guidelines. British research tends to use the DSM in order to fit in with the American research, as most psychological research that is published is widely known is conducted in the US. Previous versions of the DSM have made new conditions better known within the UK, such as ADHD and borderline personality disorder. Patients increasingly self-diagnose using medical websites which are based on DSM-5, but this puts pressure on doctors to know about these diagnoses and often offer treatments for them, even if they don't agree with them. The ICD-10 is currently being updated, and the DSM-5 may have an influence on the mental health sector of the ICD-11. The two classification systems are becoming increasingly more and more similar.